all the background knowledges that were required for learning an ECG wave and how to diagnose different disease condition with the help of ECG is already done. The previous background knowledge. Now we'll directly enter into the concept of ECG. Okay. By now it should be clear to all of you that when a depolarization wave travels to a lead, to an ECG lead, so there will be positive deflection, right? And when a repolarization wave moves away from the lead, there will be positive deflection, right? Okay, so this should be clear to you, right? Okay, now we will construct an ECG machine. Let us construct an ECG machine. We don't have any ECG machine, and we will construct an ECG machine with the help of some copper wires and with help of some voltmeters. Okay, so ECG machine is nothing but few wirings and many voltmeters, right? Okay, and ECG recording is the sum of all action potentials happening within the heart, right? It is not a single action potential, this PQRST complex, it is not a single action potential, it is the sum of all action potential happening in the heart, right? So we have few copper wires and we have some voltmeters, and with the help of these things we will construct an ECG machine. Okay, so as simple as that, ECG machine is simply a collection of voltmeters, right? A collection of voltmeters which measures potential difference between 2 points, right? Okay, so there are conventional 12 leads in ECG. So those 12 leads are 6 limb leads and 6 chest leads. Okay, 6 limb leads that we apply over the limbs, hands, feet, right? And there are 6 chest leads, V1, V2, V3, V4, V5, V6, right? We apply on the chest wall, correct? Okay. Now out of these 6 limb leads, we divide it into 2. One is unipolar lead and another is bipolar lead. Unipolar lead and bipolar leads. And within the unipolar leads, we have AVR, AVL, AVF, and bipolar leads we have 1, 2, 3, right? All the precordial leads, they are also traditionally called unipolar. But this unipolar term is very misnomer, just like what I talked in previous practical class, we discussed about pulsus paradoxus. So it is a misnomer. There is nothing paradoxus. This is exaggeration of normal phenomenon. Okay, normal fall of systolic blood pressure by 10 millimeter of mercury during inspiration is a normal phenomenon, and when it is more than 10 millimeter of mercury, we call it pulsus paradoxus. So it is a misnomer. So similarly, unipolar limb lead, it is misnomer, right? So lead cannot be unipolar. Okay, a lead is always bipolar, because what is the purpose of an ECG lead? I have already defined what is an ECG lead. An ECG lead is nothing but a pair of electrode connected in between with a voltmeter. Okay, so point A, point B, you connect this, and in between a voltmeter. Okay, so this is a lead. So definitely a lead has got 2 poles, A and B, and it measures potential difference between 2 points, right? It measures potential difference between 2 points. So there is nothing called unipolar lead. So unipolar is again misnomer. Traditionally this AVR, AVL, AVF, these are called unipolar leads, and also 6 chest leads, V1, V2, V3, V4, V5, V6, all the precordial leads are also called unipolar leads, but these are not actually unipolar. I will explain in subsequent time. Okay. And this A, AVR, AVF, AVL, A is for, this small a is for augmented, right? These are called augmented limb leads. Why it is called augmented, I will come to it. Okay, so unipolar lead, an active or exploding electrode connected to an indifferent electrode at 0 potential. So here is the explanation why we are calling it unipolar lead. Okay, why we are calling it an unipolar lead? Because its another end is at 0 potential. Okay, one end is at a point and another end is at 0 potential. Okay, bipolar lead, 2 active electrodes, positive and negative, and an ECG is recorded from one lead at a time. Remember, ECG is recorded from one lead at a time. Okay, and vectors and all this thing has been already discussed in previous class. Okay, and remember this thing, an ECG is an extracellular recording that represents the sum of multiple action potential taking place simultaneously in cardiac muscle, right? So this line is very much important. Okay, remaining things you know. So ECG is an extracellular, just the difference between ECG and action potential. Okay, action potential is not ECG, ECG is not action potential. ECG is the sum of all action potentials happening in heart, right? Okay, and there is another major difference. A ventricular action potential has a voltage change of up to 110 millivolt, whereas in ECG we observed normally in a healthy individual, normally we see a voltage change of 1 millivolt, right? But in ECG signal, an amplitude of only 1 millivolt by the time it reaches the surface of the body, right? Okay, I'll come to it. Okay, so here is the major difference. The voltage change or the change in membrane potential del Vm is 110 millivolt approximately in case of action potential, and it is about 1 millivolt in case of ECG. Okay, now come to the standard limb leads, the basic understanding of lead, right? The basic understanding of lead. As I told, point A and point B, I have connected two electrodes and in between a voltmeter. It constitutes a lead. Okay, similarly, you apply one electrode here, right arm, one electrode here, left arm, and connect it with a voltmeter, it is lead 1, right? So it is lead 1 and the direction is from negative to positive. Okay, this is the direction of lead 1. Okay, direction of lead 1. So be very clear. We have point, right arm, left arm, and left foot. Okay, if you connect this right arm, and left foot, if you connect this, you get a triangle, right? You get an equilateral triangle. That means all arms are equal in length, although not. Okay, we will assume that if you connect your right arm, and left foot, it will be an equilateral triangle, and assume at the center of this triangle, what is located? Heart, right? Although it is not exactly correct. Okay, that is not exactly an equilateral triangle, and also it is also true that heart is not exactly located at the center point of this triangle. But for the sake of our calculation, for the sake of understanding, you assume that it is an equilateral triangle and heart is located at the center point. Okay, so there is a theory in physics. If you keep charges over here, okay, if you put charges over here and you measure potential difference at the center, potential at the center, it is always 0, right? It is always 0, right? And it is called Einthoven's formula. The triangle is called Einthoven's triangle. Okay, triangle is called Einthoven's triangle, and it is called Einthoven's formula, right? So accordingly, in this unilateral triangle, equilateral triangle, so this is right arm, right? This one is right arm. See this picture, right arm, this is left arm, and this is left foot, correct? Okay, so lead 1 is this, RA to LA, the potential difference between RA and LA, it is lead 1. मतलब lead 1 measures the potential difference between RA and LA. तो हम लोग कहाँ से शुरू किए थे? We have got some copper wires and we have got some voltmeters, right? আমাদের কাছে কিছু voltmeters আছে and কিছু copper wire আছে, right? So আমরা ECG lead 1 তৈরি করব, okay? We will construct lead 1 of an ECG machine. How to do that? एक वायर लो, यहाँ पर घुसा दो, और एक copper wire लो यहाँ पर and connect it with a voltmeter. Assume, ऐसा नहीं करना है, there will be injury, right? Okay, so assume एक copper wire लिए, connect it over here. आप यहाँ पर भी connect कर सकते हो, यहाँ पर भी connect कर सकते हो. It doesn't matter. The lead, you can connect it, the electrode, you can connect it in the arm, in the forearm, or even at the wrist. No issues. Because body is volume conductor. कोई फर्क नहीं पड़ता आप lead यहाँ पर place कर रहे हो, यहाँ पर wrist पे place कर रहे हो, right? Getting my point? So wherever you put the electrode, absolutely no issues. You can put on the arm, you can put on the forearm, you can put on the wrist as well. Clear? Because your body is a volume conductor. Okay? So see this, I have placed one electrode here, right arm, and one electrode here, it is lead 1. Okay? So lead 1 will measure potential difference between RA and LA. RA and LA, right? Lead 1 will measure potential difference between RA and LA, and lead 1 is also capable of detecting flow of electricity in this direction. Correct? Flow of electricity matlab flow of action potential, flow of depolarization wave, ठीक है? Or repolarization wave. Okay, lead 1 is capable of detecting depolarization wave or repolarization wave that is flowing in this direction, RA to LA. Clear? Okay, now let us construct lead 2. You put one copper wire here, one copper wire here, connect it with a voltmeter, right? So right arm and left foot or left leg, ठीक है? Right arm, left leg. This constitutes your lead 2. Clear? Lead 2. And lead 3 is left arm and left leg. Left arm and left leg. Correct? And I told you that as we are considering flow of electricity or flow of action potential or flow of depolarization wave or flow of repolarization wave as vectors, we can move them parallelly, right? We can move them parallelly, right? So see, RA to LA, this is lead 1, okay? RA to LF, this is lead 2, lead 1, and this is lead 3. Okay? ये triangle में हो गया. Now I will move all these lines parallelly. Okay? So lead 1 is this, lead 2 is this, lead 3 is this. Do you agree? 1, 2, 3. Clear? Okay? At the center you have the heart. Clear? Okay? So again, 1, 2, 3. Okay? And here lies your heart. Clear? So, you remember fast vector? Anyone can tell me the fast vector? Yes, atrial depolarization vector. इसका direction कहाँ पर है? Yes, इसका direction है ऐसे. If it is my heart, if you are considering my heart, so its direction is this, right? So atrial depolarization vector, इसका direction होगा ऐसे. ठीक है? Clear? Okay. Now this is lead 1, this is lead 2, this is lead 3. Okay. Now atrial depolarization के लिए कौन सा ECG wave होता है? Which ECG wave is due to atrial depolarization vector? P wave, P, right? So this is the reason for P wave, atrial depolarization vector, correct? Now say from this picture, which ECG lead will give rise to maximum magnitude of P wave out of lead 1, 2 or 3? Yes, lead 2, because you see clearly this vector is coming towards lead 2, right? This vector is coming towards lead 2. So P wave, it will be taller here, right? And आप इसको, as you are considering this as vector, it has got a component here also, but small. So you get a small P wave here, right? And यहाँ पर almost no or slight P wave. Getting my point? Because all the ECG leads are sensors. They detect someone is coming towards me, right? They detect someone is coming towards me. Okay, if someone is coming towards me, there will be upward deflection, right? And if it is moving, if the depolarization wave is moving away from me, there will be negative deflection. Okay, there will be negative deflection. Okay, now see all the leads. These are basic 3 leads, lead 1, lead 2 and lead 3. For convenience, we always discuss everything in respect to lead 2. Clear? Now let us come to the other leads as well. Okay, now you see this picture clearly, whatever I have drawn over here. Okay, lead 1, lead 2 and lead 3. Clear? Okay, so lead 1 is LA minus RA, matlab V, matlab voltage at LA minus voltage at RA, right? Similarly, lead 2 is LL minus RA, lead 3 is LL minus LA, right? And this is also the Einthoven's law, what I have just told. Okay? The combination of all the charges is 0. That means VRA, VLA, VLL is equal to 0, and also lead 1 plus lead 3 is equal to lead 2. This is Einthoven's formula. Okay, these are told already. Now come to precordial leads. Okay, precordial leads. So leads are applied to the patient in 2 planes. One is sagittal plane. Okay, you know what are the sagittal plane, transverse plane, coronal plane, all these things has been discussed in anatomy, right? So what do you think? Lead 1, 2, 3, these are located in sagittal plane or what plane? These are located in this plane, coronal plane, right? Okay, similarly, precordial leads are located in a transverse plane. Let me show you the picture. See this? Okay. So this plane, in this plane, lead 1, 2, 3, AVF, AVL, AVR are located. All lead 1, 2, 3, AVF, AVL, AVR are located in this plane, right? The coronal plane. And in this transverse plane, all the precordial leads or the chest leads are located, right? Now see the location of the chest leads, and you need to remember the location of the chest leads. So here is the location of chest leads. So it is a transverse section, and you see the location of chest leads surrounding, right? Location of the chest leads surrounding. I guess the locations are already written over. So V1 is the right 4th intercostal space, right fourth intercostal, you need to remember this, eta mukhosto korte hobe, right? So location of V1, how to put the chest leads on the patient, right? So V1 is the right fourth intercostal space, just lateral to midline, okay? V2 is left side of the sternum, again in the fourth intercostal space. Don't remember the location of V3 because it is midway between V2 and V4. Now the V4, it is mid-clavicular line, okay? V4 is mid-clavicular line and fifth intercostal space. This is clavicle, right? Supex ho gaya na, superior extremity anatomy mein, upper limb ho gaya. Okay, so this is clavicle, this is mid-clavicular line, and you see the location of V4, okay? V1 is the fourth intercostal space, just lateral to sternum. V2, again fourth intercostal space on the left side, just lateral to sternum. Don't remember V3 because it is midway between V4 and V2, right? V4 is located in the mid-clavicular line, fifth intercostal space. Again, V5, it is anterior axillary line, fifth intercostal space, right? And V6 in the mid-axillary line, okay? It is in the mid-axillary line at the same level as V4. Clear? So V4, 5, 6, all are in the fifth intercostal space. V4 is the mid-clavicular line, V5 is the anterior axillary line, and V6 in the mid-axillary line. Clear? You need to remember the placement of all the chest leads, right? You need to remember all the chest leads. Similarly, you see, in the coronal plane, what we have discussed, this is the coronal plane, this board is the coronal plane, okay? This plane, okay, this plane. And if you do a transverse section like this, you get this plane, okay? Okay. So in the coronal section, as you have seen that this vector, the atrial depolarization vector, as it is going towards lead 2, so lead 2 will be a positive deflection. Similarly, in the transverse section, you see, actually the vector, what I have drawn, it is not 3-dimensional, right? It is actually 3-dimensional, it is not 2-dimensional, okay? This atrial depolarization vector, atria to bahut piche, right? Apex is slightly in front, okay? So atrial depolarization vector is actually located in, direction is in this way, right? In this way, in a 3-dimensional plane, okay? In a 3-dimensional plane. So you have one x-axis, y-axis and z-axis, and it is located in this way, because heart is a 3-dimensional structure, okay? Heart is a 3-dimensional structure, right? And the atrial depolarization vector is located like this, okay? So it has, in the coronal plane, it has got this component, okay? And in the transverse plane, it has got this component. Clear? Okay. So accordingly, the rule is same for all the leads. If a depolarization wave moves towards the lead, there will be positive deflection, and the depolarization wave moves away from the lead, there will be negative deflection, right? So here the location is, say, V1, V2, V3, V4, V5 and V6. V6 is mid-axillary line, okay? V6 mid-axillary line, then V5 anterior axillary line, V4 mid-clavicular line, okay? And here V1 to 3. Okay? So here is the heart. If any vector moves towards this, so there will be positive deflection in V1. Okay? If a vector, say for example, it moves in this line, there will be positive deflection in V6 and negative deflection in V1. Clear? Say for example, a vector is moving in this direction, okay, towards this light, the CCTV camera, right? So if a vector moves in this way towards this camera, so what will happen? There will be positive deflection in V6, but negative deflection in V1. Getting my point? Okay? Chalo. Again, the positions are shown. Okay, now come to the augmented limb leads. What are augmented limb leads? Okay, by now we have known lead 1, lead 2, lead 3 and V1 to V2 V3 V4 V6 ঠিক আছে এই জায়গাটা একটু মুখস্থ করতে হবে হ্যাঁ মানে খুব বেশি কনসেপ্ট কিছু নেই আপাতত মুখস্থ করতে হবে রাইট ওকে সো 1 2 3 কাকে কাকে কানেক্ট করে ইউ নিড টু রিমেম্বার লিড 1 RA LA কে কানেক্ট করে লিড 2 RA LF কে কানেক্ট করে লিড 3 LA LF কে কানেক্ট করে রাইট এটা মনে রাখলাম আর কি মনে রাখবো V1 2 3 4 5 6 সবকটার পজিশন হ্যাঁ এবার একটা কোশ্চেন আসতে পারে দেয়ার মাইট বি ওয়ান কোশ্চেন এন্ড দ্যাট কোশ্চেন ইজ all the leads are connecting 2 points but why chest leads 1 point one single point the right fourth intercostal space the left fourth intercostal space mid clavicular line fifth intercostal space so there is not a single point it is also a lead and if it is the lead it must be measuring potential difference between 2 points say for example lead V1 okay V1 kahan par hai the location is fourth intercostal space okay fourth intercostal space just lateral to sternum fourth intercostal space this is the position of V1 okay but lead क्या एक single point होता है lead तो 2 point होता है RA LA 2 point lead 1 right but why for V1 only a single point yes there is another point that is within the machine that is zero potential point उसके साथ compare कर रहा है right okay so V1 is also 2 electrode 1 electrode is at zero potential and another point is this point okay just like lead 1 which measures potential difference between right arm and left arm similarly V1 is also measuring potential difference between 2 points one is zero potential within the machine within the ECG machine and another is this point right fourth intercostal space clear so this is why unipolar lead name is misnomer nothing is unipolar lead যখন হয়েছে it must be bipolar ঠিক আছে okay now come to augmented leads so first augmented lead AVR what is AVR okay AVR is the lead so हम लोग कहाँ से शुरू किए थे we have got some copper wires and we have got some voltmeters so let us अभी हम लोग construct करते हैं lead AVR ठीक है तो lead AVR को कैसे construct करना है so you take one copper wire ठीक है एक copper wire आप left arm में डालो right one copper wire you put on left leg दोनों को connect करो दोनों wire को connect करो and उसको black tape से wrap कर दो and now you get a terminal and with this terminal you connect a voltmeter with RA clear okay मतलब your AVR is again 2 points okay any lead will measure potential difference between 2 points so can you say what are those 2 points for lead AVR AVR is measuring potential difference between RA and a common point connecting LA and LL okay so take a copper wire put it on left arm again another copper wire on left leg दोनों कॉपर वायर को आप एक साथ रैप कर दो ब्लैक टेप डाल दो एक टर्मिनल हो गया उस टर्मिनल से राइट आर्म दिस इज योर AVR okay so if you write it in formula so AVR is equal to RA minus LA plus LL by 2 you agree RA minus LA plus LL by 2 not clear RA this is one terminal and you put copper wire here connect these two get a terminal and you connect voltmeter here ठीक है so this is RA and this terminal is LA and LL by 2 ठीक है so AVR is equal to RA minus LA plus LL or LF whatever by 2 clear similarly if you take AVL you take two copper wire put one on right arm, put one on left leg, connect these two, you get a terminal and left arm, okay, in between a voltmeter. Alright, clear? Okay, and finally AVF. AVF is right arm and yes, AVF, okay, right arm, left arm, दोनों को connect करो, you get a terminal and with the LL you connect it with the voltmeter, okay. So LL minus RA plus LA by 2. Clear? Okay. So these are augmented limb leads and तीनों का direction is this. This is the direction of AVR. This is the direction of AVR. This one is the direction of AVL and this 90 degree is the direction of AVF. Okay. Now the question is, what are the leads that are located within the coronal plane and what are the leads that are located in the transverse plane? बताओ? Anyone? कौन कौन सा लीड है जो ट्रांसवर्स प्लेन में है एंड कौन कौन सा लीड है जो कोरोनल प्लेन में है? Anyone? बोल. लीड 1 to 3 कोरोनल प्लेने আছে আর V1 থেকে V6 ট্রান্সভার্স প্লেনে আছে আর এগুলো AVR AVL AVF কোন প্লেনে আছে? সেম কোরোনাল প্লেনে আছে. ভেরি গুড. ঠিক আছে, তাহলে V1 to V6 all the chest leads are located in transverse plane and all the remaining leads like 1 2 3 AVF AVL AVR everything is located in the coronal plane. ठीक है? Okay, now see all the leads together. যত লিড আছে সবকে একবারে দেখবো, রাইট? আচ্ছা, এটা আমি বোর্ডে দেখিয়ে দিচ্ছি. See all the leads together. Okay, so everyone remember this picture. We start here 0 degree. Okay, this is positive direction and this is negative direction. Okay, this is positive direction and this is negative direction. So lead 1 is located at 0 degree, lead 2 is located at 60 degree, lead 3 120 degree, right? Lead AVF 90 degree. Okay, lead AVF টা আবার দেখাচ্ছি, right? Lead AVF, see lead AVF is at 90 degree. Lead AVF কি ছিল আবার দেখাচ্ছি. Lead AVF, AVF, see 90 degree. Okay, this is the direction of lead AVF, which is LL minus RA plus LA by 2. ठीक है? And see this is AVR and this AVR and this is AVL. Okay, so AVR AVL AVF. আমি শুধু যদি AVR AVF আর AVL টা আঁকি. Okay, so this is AVR, this is AVL and this is AVF. Okay, তাহলে see all the leads in the coronal plane all together একসাথে. So this is this one. Okay, প্রত্যেকটার অ্যাঙ্গুলেশন মনে রাখতে হবে, এভরি লিডের অ্যাঙ্গুলেশন মনে রাখতে হবে, রাইট? সো লিড 1 0 ডিগ্রিতে আছে, লিড 2 আছে 60 ডিগ্রিতে, লিড 3 আছে 120 ডিগ্রিতে, লিড AVL minus 30 degree, AVR minus 150 degree, AVF plus 90 degree. ठीक है? Clear? You need to remember these things. Okay. Now আমি বোর্ডে ড্র করছি. You tell me which lead is this? Lead 1, lead 2, lead lead good, lead lead clear. And here lies your favorite thing, heart. Correct? Okay. Now, simply again take the example of atrial depolarization vector. Okay? You take the example of atrial depolarization vector. Okay? Direction is this. It is moving towards which lead? Lead 2. So, maximum amplitude of this P wave will be in lead 2. Okay. अभी बताओ, पिक्चर देख के बताओ, लीड P wave नेगेटिव होगा कौन सी लीड में? Yes. AVR में P wave will be negative. ठीक है? There will be negative deflection in AVR for P. Right? Now बाकी जो vectors है हार्ट में, the septal vector, okay? The septal depolarization vector that occurs left to right, छोटा सा, ठीक है? According to the direction, देखो यहाँ पर positive deflection, right? यहाँ पर slight positive deflection. So depending on इसका component कहाँ पर है, okay? So depending on that, similarly, the apical vector, which is the strong vector, apical vector which depolarizes the cardiac apex, इसका direction भी more or less towards the atrial depolarization vector, right? Towards the atrial depolarization vector, the apical vector. Again, you will get a strong R wave here in lead 2, and it will be negative here, S wave. Clear? So, depending on vector's component, ECG leads shows the deflection. Okay. I'll tell you one, one thing that will help you to remember. Okay. Don't take it otherwise. So, you suppose there is a beautiful girl located here. Okay. A beautiful girl located here. And here are many boys. Here, 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 here. All are boys. And at the center, there is a beautiful girl. Okay. Correct? Now, depending on whether the girl is moving towards this boy, this boy, this boy, this boy, there will be positive or negative deflection. Clear? So, if the girl moves towards this guy, there will be positive deflection. Right? If the girl moves away here, there will be negative deflection. Clear? Okay. Okay. Now, we have known the ECG leads 1, 2, 3, AVF, AVL, AVR located in the coronal plane and V1 to V6 located in the transverse plane. Same thing happens in the transverse or the precordial leads as well in the transverse plane, right? If a vector moves towards V1 or V2 or V3 or V6, there will be positive deflection. If the depolarization wave moves away from the lead, there will be negative deflection or downward deflection. Okay? Chalo. Now you need to, the thing is, you need to, this is all together, both the coronal plane and horizontal plane, transverse plane, coronal plane and transverse plane all together. You see, you can see all the leads, right? You can see all the leads, and depending on towards which lead the vector is moving, there will be positive or negative deflection. Is shown to you. Okay. Now ECG papers. Okay, the standardization of ECG paper or the calibration of ECG paper. How to do that? So in ECG paper we have such graphs. Okay. Now remaining part of ECG is will be practical topic. Right now practical is going on pulse examination of arterial pulse. After that you will practice once again your differential leukocyte count, and then we will directly move into ECG practical, where you need to perform ECG, you need to connect the ECG leads and perform ECG upon yourself. Okay, we have no patients. Right now we will not provide you patients. Okay, you will do ECGs, okay, among yourself. Okay, you will perform ECGs among yourselves. Okay, and we will check. So this is the ECG paper. So we have very small tiny squares and we have some large squares. Okay, so can you tell me in the ECG what x-axis mean and what y-axis mean? X-axis is time, simply time, and y-axis is voltage, right? Y-axis is voltage, x-axis is time, y-axis is voltage. Now you enlarge this large square in this way. So if you take one very small square, take it out, one very small square, the smallest square, you take it out here. The x-axis is equal to 0.04 seconds or 40 milliseconds. 0.04 second or 40 milliseconds. And on the y-axis, 1 millimeter is equal to 0.1 millivolt. Okay, 0.1 millivolt, right? Now say for example, if I do this, say for example, one positive deflection is, just I am drawing with the help of this pointer. So say for example, one positive deflection is this. You tell me its voltage. One positive deflection is this. You tell me its voltage. मतलब there is a positive deflection or R wave, say for example, ऐसे, इसका voltage बताओ. Yes. How many small squares? 15. And one small square means 0.1 millivolt. Okay? 0.1 millivolt. So the positive deflection is 1.5 millivolt. Correct? 1.5 millivolt. As आपको पूछा जाएगा during practical examination, you will be given one ECG strip of a patient or of a normal subject, right? And we will ask you, tell me the voltage of R wave in lead 2. Okay? I can ask you, or I can ask you, or the examiner can ask you, tell me the PR interval, right? In this way. Okay, I'll come to PR interval later on. So when someone is asking you about the interval, then you need to calculate according to the horizontal axis or x-axis. Okay, say for example the duration of this. Tell me the duration of this. This is 0.2 second. How? Because there are 5 small squares and each small square is 0.04. So 0.04 into 5, it comes to 0.2 second. Right? Simply I can do like this. Say for example, the same R wave. Okay. So I am putting a positive deflection as is starting here and it is ending here. Okay. And you told me that the height is how much millivolt? 1.5 millivolt. Now tell me the duration of this wave. One wave is this, starting here and ending here. What is the duration? Yes, 0.4 into 0.04 into 5. Okay, that is 0.2 second. Clear? So as if for any wave, say for example QRS complex, I can ask you the net voltage of QRS complex. I can ask you the duration of QRS complex. Okay, if I ask you the duration of QRS complex, then you need to count the number of small squares between QRS, okay, and multiply it with 0.04, right? If I ask you the voltage of QRS complex, you will count the small squares in the y-axis and multiply it with 0.1 and you get the voltage. Clear? Okay. Okay, these things are already discussed, the vectors and the resultant waves. So now tell me, P wave is due to atrial depolarization. QRS is due to ventricular depolarization. T wave is due to ventricular repolarization. Now tell me, where is atrial repolarization? Okay, very simple question. Very simple question. I am drawing the ECG wave traditionally, conventionally in lead 2. Okay. So P wave, Q, R, S and T. Clear? So P, Q, R, S and T. Okay. You are telling P is for atrial depolarization. Right? QRS is for ventricular depolarization. T is for ventricular repolarization. Now tell me, where is atrial repolarization? AR, atrial repolarization. क्वेश्चन समझ में आया कि नहीं, ये पहले बताओ. दिखता है ECG में एट्रियल रीपोलराइजेशन? नहीं दिखता. क्यों? Yes, atrial repolarization and ventricular depolarization, these are happening at the same time. And atrial repolarization is so small voltage, it is buried under the large QRS complex due to ventricular depolarization. ठीक है? Due to ventricular depolarization, QRS complex is so strong that atrial repolarization wave, it is covered, it is buried under QRS complex. Clear? Okay. Atrial repolarization and ventricular depolarization, they are happening simultaneously and you get a combined QRS complex. Okay. And absolutely there is no effect of atrial repolarization because QRS complex is so strong. Clear? Okay. Now we will see few things, ECG waves. Time हो गया क्या? তুই না কটা বাজে? 3:30? ठीक है, थोड़ा सा. ठीक है. P wave, QRS complex and P wave. जो लिखा है सबको पता है, right? P wave is due to atrial depolarization. P wave is recorded before the onset of atrial systole. Atrial repolarization occurs at the same time with ventricular depolarization, just what I told. Okay. But since the ventricular depolarization wave is giant, it masks the atrial repolarization wave. Clear? Okay. Now QRS complex, it is due to ventricular depolarization, right? QRS complex is recorded before the onset of ventricular systole, and on the T wave, due to ventricular repolarization, it happens before ventricular diastole, and usually the direction is same as R wave. R wave का जो direction है, same direction में T wave होगा, because it is repolarization wave, it is not depolarization wave. Depolarization wave moving towards the lead means same, repolarization wave moving away from the lead. ठीक है, both will give rise to an upward direction, upward deflection. ठीक है, so इसीलिए T wave is also positive. जहाँ पर QRS पॉजिटिव वेव दे रहा है वहाँ पर T wave भी पॉजिटिव होगा. ठीक है. Okay. Now see, this is P wave. Okay. Now from starting of P to beginning of QRS, this duration is called PR interval. PR interval, not PQ interval, although it is from the start of P to beginning of Q. It is not called PQ interval, it is called PR interval, right? From the start of P to beginning of Q. This is called PR interval, right? Okay. Finally, one wave U, usually दिखता नहीं है, but maybe seen in some patients. U wave, PQRST and U wave. Okay, U wave is due to slow repolarization of the papillary muscles. Okay, if anybody asks, just remember U wave usually not seen in an ECG, right? Seen in some disease condition, we will later discuss, right? And U wave is due to slow repolarization of papillary muscle. And this is the isoelectric line or baseline. Okay. So there is this isoelectric line or baseline means that there is no net flow of electricity. Okay. During this time. So this is also isoelectric line. You see, this is isoelectric line. After QRS complex, you see this isoelectric line, and before the beginning of T. This is called ST segment, and the beginning of ST segment is called J point, and this is called your ST segment, which is usually isoelectric or at the baseline in a normal healthy individual. Clear? Yes, U wave is rarely present. It is due to slow repolarization of papillary muscle. Okay, we will discuss all the intervals, the PR interval, QT interval, RR interval.